While there is some concern, obviously, that African Americans may be lagging behind in getting the vaccine.
And the percentages show that right now. Tonight, we're looking into the reservations many have in this community. Channel 3 Eyewitness News reporter Matthew Campbell has found it stems from multiple incidents of mistreatment that spans decades.
It's not that we're not interested in the vaccine. We want to see if there's more. Unfortunately, we want to see other guinea pigs that are involved in the process.
Local African Americans say these feelings are all too common in their communities.
It's human nature. You know, not everyone runs to what's new.
A Kaiser Family Foundation poll shows as of December, 35% of the African American community said they definitely not or would probably not take the vaccine.
But people are apprehensive because they don't really necessarily trust the medical profession.
We wanted to explore those trust issues and dug up some painful facts that may be leading the Black community to wait to get their doses.
Glad to be here.
Dr. Robert Sanders from the University of New Haven highlights the shameful history that has sown this skepticism. The Tuskegee trials that began in 1932 were started by the U.S. Public Health Service as a study about syphilis. 600 Black men were enrolled.
A group of 201, a control group who did not have syphilis, and 399 who did. They told them they had bad blood.
But no treatment was actually given.
They watched them die as the disease progressed through their bodies, so they could see how the disease manifested itself.
But no treatment was actually given. And even after penicillin was available to treat the syphilis, it wasn't offered to these Black men, and the study continued.
They decided, despite the ethical ramifications, to continue the experiment.
The disease was passed on to their wives and children, and it was only exposed in the 1970s after a reporter investigated. But even before the Tuskegee trials, there was Dr. Marion Sims, who performed trials on female slaves without anesthesia. Dr. Sanders points to the case of Henrietta Lacks as another instance of Blacks being medically exploited. Lacks, a young Black mother of 5, had cervical cancer in 1951. Her cells were harvested, her family says without consent, and 70 years later, they continue to be used for research.
They've said if you stack the number of cells that hers have been replicated and now in labs around the world, they would weigh 50 metric tons.
Even though decades have passed, NAACP Stamford President Guy Fort says it's easy to see why the doubt remains.
Social media specifically is showing negative aspects of what the vaccination is doing to some people.
The narratives include, as you know, it causes abortion, it alters DNA, it's nothing but the Tuskegee study all over again.
Dr. Reginald Eady is the president of Trinity Health New England, and he sits on the Vaccination Advisory Group, and he admits it's hard to convince people to forget about the past and believe in science.
We have to bring about the facts, and we've got to undo the narratives, the negative narratives that so commonly are expressed across the country. It has not been easy, man.
Eady says he has daily conversations with his community, and he says earning trust starts with dealing with facts, good or bad.
Once we do that and we admit that there were some misbehaviors of the U.S. government in the past, and then I transition into let's talk about why it's important that you leave that in the rearview mirror.
Dr. Tabitha Fort has a family practice and has the same conversations. She tries to present the reality that COVID is harder on her community.
Diabetes, high blood pressure, heart disease, obesity, those have been pandemics in our community for many years. Now we have an additional pandemic that doesn't take 30 years to kill you, doesn't take 30 years to incapacitate you. It could take a weekend.
And doctors say the community is warming up to the vaccine, especially after seeing people they know get it. Now, the state is also planning on ways to bring the vaccine to the community, and they're using churches. We saw this during the testing phase where a mobile unit would be brought to a church. The same plans are being made now with the vaccine. That is the latest. Here in Hartford, Matthew Campbell, Channel 5 News.